Hello, today I will be discussing the ethical implications of GLP-1 receptor agonists such as semaglutide and tirzepatide in modern healthcare. I will examine whether these drugs should be publicly funded and how their benefits and costs create ethical trade-offs in society. Ethical framework. This analysis is based on the ACM Code of Ethics and Professional Conduct. The ACM framework emphasizes avoiding harm, promoting public good, and ensuring fairness and being honest and transparent in professional work. In healthcare related systems, these principles apply to how medical treatments are distributed, priced, and accessed. Professionals have a responsibility to ensure that decisions about healthcare technologies are based on accurate evidence, protect vulnerable populations, and avoid bias in systems that determine access to treatment. What do GLP drugs do? GLP-1 receptor agonists were originally developed to treat type 2 diabetes, but they are now widely used for obesity and related conditions. They work by increasing insulin, lowering glucagon, slowing digestion, and reducing appetite through brain signaling. Clinical trials like SELECT and FLOW show that these drugs reduce heart attacks, strokes, kidney disease progression, liver disease, and sleep apnea severity. Importantly, research also shows that some benefits occur even without major weight loss, suggesting the drugs may have benefits beyond appetite control alone. So, the benefits. From an ethical perspective, GLP-1 drugs provide strong benefits because they reduce serious and life-threatening diseases. Lower rates of cardiovascular events, kidney failure, and liver disease mean improved quality of life and reduced mortality. Under the ACM principle of benefiting society, this supports making these drugs accessible, especially for high-risk individuals. Preventing major diseases also reduces long-term healthcare costs, which benefits both individuals and the healthcare system as a whole. The concerns. However, there are also ethical concerns, mainly related to cost and fairness. The Reuters report shows that employers are beginning to reconsider coverage because these drugs are extremely expensive and demand is growing rapidly. Since insurance spreads across all employees, people who may not use or benefit from the drug are still paying for it indirectly. This raises fairness concerns about how healthcare resources are distributed and whether rising costs could reduce access or strain insurance systems in the future. Professional responsibilities. Healthcare and computing professionals involved in these systems have important responsibilities under the ACM Code of Ethics. They must ensure that data used to determine eligibility for GLP-1 drugs is accurate, unbiased, and transparent. They also must protect patient privacy when handling sensitive health and insurance information. Additionally, professionals should avoid misleading interpretations of clinical data and ensure that access policies are based on evidence and medical necessity rather than financial incentives or incomplete information. Stakeholders and resource allocation. Multiple stakeholders are affected by GLP-1 coverage, including patients, employers, insurance companies, and taxpayers. Insurance works by pooling resources, meaning that costs are shared across many people. This creates a redistribution of money from the general insured population toward individuals who use these medications. Ethically, this can be justified if it reduces serious disease and improves population health outcomes. However, if costs continue to rise, employers may reduce coverage, shifting more financial burden onto individuals and potentially limiting access. In conclusion, GLP-1 receptor agonists present both strong benefits and important ethical challenges. They significantly improve health outcomes by reducing cardiovascular, kidney, and metabolic diseases, and these effects often extend beyond weight loss alone. However, their high cost creates concern about fairness and sustainability within insurance systems. Ultimately, the ethical decision is not whether the drugs work, but how society should balance medical effectiveness with fair and sustainable resource allocation so that those who need the treatment most can access it.